Hello and welcome to week 9 of PA122. This week we are in chapter 7 of your advanced pharmacy book. We're starting on page 135. And I have to be honest, this is a pharmacy I've never actually gotten to work in. I've worked in hospital, compounding, retail pharmacies, but never an infusion pharmacy where they send home with you things that you can use at home. So your discussion question talks about a patient who is at home who has an infection and what she needs, and this chapter will help you to answer that. So let me just give you a brief introduction. Home infusion pharmacy is a unique practice, so you're not going to find a whole lot of them out and about, especially in small towns. You'll probably find them in metropolitan areas. So if you live in the St. Louis area, Kansas City area, you'll probably see them most likely there. It might be a pretty interesting place to actually work. It's a preparation of sterile products, so you're also in the hood, or you could be in a clean room, and so you would really need to have extensive knowledge on aseptic technique. Home infusion pharmacy is complex. It offers wide range of patient ages, medical conditions, and an expanded pharmaceutical care role of the pharmacist. So with the pharmacist, they would have to be on call basically to answer any questions that the patient might have while they're at home. That doesn't go to say that there isn't need to be a nurse there to help. So most of these patients probably have an in-home nurse that comes to see them and to help them hook up this home infusion, make sure that they're using it right, that kind of stuff. Okay, so let's kind of talk about what kind of therapies you can do at home with the home infusion pharmacy. Anti-infective therapy, and this is kind of what your discussion question is about, antifungal therapy. And the reason that they would want to do an anti-infective therapy at home for maybe an immunocompromised patient is because if you go into a hospital, you're more likely to get another infection. So doing it at home is actually safer for the patient. So it's great that they can offer this while at home. There's also some pain management therapy, chemotherapy, nutrition therapy, and this has to do a lot with parenteral nutrition. Parenteral nutrition, I can't get my words out today. There's also other miscellaneous therapies like heparin, steroids, proton pump inhibitor, that kind of stuff. So some elements of the home infusion pharmacy, obviously you're going to have some personnel that helps with like the pharmacist, the infusion pharmacist, a specialized pharmacist who understands compounding, understands the therapies and that kind of stuff. Also, a driver is needed because they will deliver these medications right to the patient. You can't expect them to come out like kind of like a hospital. They've kind of got it set up at home. You'll also need someone to help take inventory. Your pharmacy design is going to look a little bit different. It's probably going to be back in a room, no windows, because there is a clean hood. So I know that of 2 infusion pharmacies in St. Louis, I used to send my students to it. One is located in, I think it's Clayton. I think that's the boundary, but I could be wrong. And it's basically a locally owned independent pharmacy. So on one side they do compounding and on the other they do infusion therapy. And they have 2 pharmacists, one who works on one side and one who works on the other. So it's hard for a pharmacist to switch back and forth, that they need to be a specialized pharmacist in that area. Let's just skip to, I kind of wanted to talk to you about what your role as a pharmacy technician looked like in that. There's a lot of forms you would fill out. I love that they have these in your book so that you can look at it. It's very detailed. I am not a detailed person, so this type of pharmacy would not be good for me. There's also some infusion devices that you can look at, but I wanted to get to This is a long chapter, the home infusion pharmacist. The role of the pharmacy technician. This starts on page 158. It's a very important one pertaining to compounding of sterile products and handling of home infusion equipment and supplies. Having the pharmacy technician perform these activities allows the home infusion pharmacist time to perform critical clinical activities. So really what they're saying here is you have to be a specially trained pharmacy technician, one that the pharmacist really trusts, because he is not going to stand here, he or she is not going to stand here right by your side watching every single movement. That's why you have these forms. That's why you tell them what you're doing when you're doing it. And you lay out the syringes of how much you put in and that kind of stuff. So you have to have that general knowledge and that trust from the pharmacist. So it is a very specialized type of pharmacy. Having sterile compounding, making sure you know how to order the equipment and the supplies, a computer function when you're printing out the labels. It's not just a label that you have to print out, but you have to put it all in the computer. I hope this helps you understand home infusion pharmacy a little bit better. You do have an assignment due this week and also a quiz, chapter 9. So make sure, week 9, so make sure that you finish that. If you have any questions, please let me know, but have a great week.